Hi there, everyone. I'm Alex Savidge from KTVU Fox 2 News in the San Francisco Bay Area. And we are joined now today by Jeff Szymanski, who's the Executive Director of the International OCD Foundation. And Jeff, we really appreciate you coming on today. Let's start with the challenges that those living with OCD are facing during the coronavirus pandemic.
Absolutely. So let me give you a little bit of just kind of education about what obsessive compulsive disorder is. People with obsessive compulsive disorder have intrusive thoughts and images that generate a lot of anxiety and a lot of distress. And these can be lots of different themes. So there can be contamination, there can be fear of harm befalling themselves or a family member. It could be a religious theme, it could be violent or sexual unwanted thoughts. So there's a lot of different subtypes and a lot of different obsessions in obsessive compulsive disorder. The compulsions are repetitive behaviors that people are engaging in order to get away from the obsessions or decrease the anxiety. Now, in order for it to be a disorder, it needs to be interfering with your ability to function. It needs to be extremely distressing. It needs to be very time consuming. It's getting in the way of your ability to work and socialize. So prior to COVID, we were hearing a lot of the phrase, I'm so OCD, and that's really a phrase that we find not particularly helpful.
Right.
In the era of COVID, we're hearing another version of that, which is now I understand what it's like for people with OCD, and actually you don't understand what it's like for people with OCD. So I think that's kind of one of the challenges is now that OCD in part is known as kind of the germaphobes and people with contamination worries. And again, that's one of our population. But yes, that group is struggling quite a bit. But the stigma, I think, associated with OCD, that we're all OCD right now is one of the things that's pretty challenging.
I was reading, one of the things that those with OCD, they struggle to find certainty. And it just seems like right now there is so much uncertainty in the world. What are the tools that someone living with OCD can be using at a time like this to try to find some certainty? What advice are you giving to people?
Yeah, so really the core struggle for people with OCD is twofold. It is a struggle with not knowing something for sure. So not being able to sit with uncertainty. And then there's a struggle of the discomfort of the anxiety and trying all the time to move away from that anxiety. So again, as you're listening to me talk about that, I think a lot of us are experiencing that right now, where this is very uncertain for all of us. There is a lot of anxiety we would rather try and get away from. And so what's interesting is that one part of our population is struggling more than the average person, and another part of our population is actually doing, I think, better than most people. Because if you've been through effective treatment for OCD, which really targets sitting with anxiety, learning to tolerate anxiety rather than pushing it away, learning to embrace uncertainty, learning to live your life around uncertainty, these are the skills that are taught in therapy. And so we're finding a certain section of our population saying, yeah, I know how to roll with uncertainty. I know how to roll with these difficult times. I've learned the skills of learning to not get caught up and lost in my thoughts, learning that when I'm anxious to still engage in valued and important activities. We have our patients that are at home still getting treatment, but they're doing a good job of structuring their day. They know the importance of structure, where I think for a lot of us, when we got pushed out of our work setting, we had to create structure from nowhere. And so, these are some of the skills I think we're hearing kind of across the country from therapists working with lots of patients saying, some of these guys are just doing better than their own coworkers or in some cases themselves.
That's very interesting. How challenging has the stay-at-home self-isolation aspect of the pandemic been for people with OCD? Because obviously, if you are, especially if you're self-isolating and you're on your own, it's a lot of downtime. It's a lot of time for that fear, for that uncertainty to creep into your mind.
Yeah, and again, when you've been through effective treatment, you already know that it's important to stay social, to
Mhm.
stay out of your head, to stay active. And so we're seeing, again, a lot of our patients are already employing some of those skills. People that, however, have not been in treatment, we're providing a lot of resources through our organization. So we're at iocdf.org,
Mhm.
and we've been running town halls on Wednesday nights for parents, families, kids, teens. On weekends, we're going through a bunch of different topics, including things like self-care. So really just trying to give lots of tips and strategies so that people don't lose their way in this time.
Obviously, part of, I think part of the treatment for people who live with OCD is trying to relax and trying to remember in the end, right, that there is no dire threat out there. But of course, at a time like this, that seems difficult, because that's all you're hearing, is that there is this dire, that's, I think, how a lot of us feel, is that there is this dire threat that's sitting out there. So how do you, in terms of in terms of the treatment, how do you square those two things?
Yeah, so again, kind of the difference between OCD and non-OCD anxiety is OCD anxiety is, again, an exaggerated sense of threat.
Mhm.
So virtually everything we do, frankly, is risky. If you get into a car, I mean, I've been tracking worldometers and looking at the number of people that die in car crashes every year. I mean, that's a very risky activity, right? So there's a way in which what's happening for people with OCD is that there's a part of their brain that is very overactive and sees exaggerated threat in a way that we don't. But in some ways, we also live our lives as though things are not risky when sometimes they are risky. We get on planes, we get in cars, we go out to the grocery store prior to COVID and we might have gotten the flu and died of pneumonia. So there's those kinds of things that are going on. So again, I think what we're talking about with people in treatment right now is this is a threat. We're all experiencing this threat. And so how can you continue to live your life as normally as possible, not letting the OCD rules kind of play havoc? To still get out of your house, to still exercise, to again follow various rules and guidelines that have been set out that we're all following. So we're asking people with OCD, like, pick your rules, pick your source of information, and again, continue to live your life as normally as you can. But again, this is not a normal time for anyone.
Specifically, when we talk about the subset of folks who deal with contamination OCD, is there any sort of reassurance in in the fact that all of a sudden all of us now in society seem to be obsessed with cleanliness and making sure that we're not passing along germs and ultimately this virus to one another? I mean, it seems like the world is as clean as it's ever going to be at a time like this, just sort of going out into society. Is there any sort of reassurance in that?
Mm-hmm. Well, a couple things about that. One is that, so a lot of people in our community are saying, in ways in which people in my life didn't maybe always have a lot of empathy or didn't really quite get what chronic anxiety felt like. This is what chronic anxiety feels like.
Mm-hmm.
And so it isn't, again, I don't have OCD. I'm not saying the anxiety I have is like the anxiety that an individual with OCD has. I think it's very important to differentiate those. But I do think that there's some kind of sense of like, this is hard, this is difficult, when you're always anxious, when you're always hyper vigilant. Like now when I go to the grocery store, I'm exhausted when I come back because I'm trying to stay 6 feet away. I don't want to touch my phone. I'm looking to see, I'm washing my hands when I'm coming in the house also. And so you are seeing also in the general population, OCD looking behaviors. Mm-hmm. And I'm having a conversation even in my personal life with people, who's touching the mail and not, who's using gloves and not. Right. How many times are you washing your hands? Are you disinfecting groceries? So it's been very interesting. I think the other piece of reassurance is what we're asking people with OCD to do is to say, make sure that you're not in front of the TV all the time.
Yeah.
Again, pick your sources of information and really limit the amount of time you're spending getting new information. What's funny about anxiety is that it's a very activating emotion. And so we get this information and then we all want to do something with it. Well, there's nothing we can do. We're getting activated to just sit at home and sit on our hands. And so there's no need to continue to digest as much information as possible. We're really encouraging people to not do that.
You raise an interesting question here. I mean, do you think that once, as a result of this pandemic and everybody, a lot of us being more obsessed with cleanliness and the germs that are surrounding us, and like you talked about the trip to the supermarket, do you think that you might see more people deciding that they will seek out treatment for obsessive compulsive disorder as a result of this pandemic?
Well, I think two things are going to happen. Yeah, no, I think a number of things are going to happen. One is that everyone has moved to virtual therapy. I don't know any therapist right now who is doing in-person treatment. Now, what's interesting about that is that in order to access effective OCD care, you actually need to go to an OCD specialist who's had specialized training. Mm-hmm. We don't have enough OCD therapists, and so a lot of our providers have been doing virtual care because they've been, someone is in rural Alabama, can't drive 2 hours for treatment, although we know people that do that also. I think COVID is really going to change how mental health care is delivered. I think we're going to find that in some cases, virtual therapy might actually be better than face-to-face. So for example, for an anxiety disorder, treatment is more effective when you are already activated, you're already anxious, and you're learning the skill of how to sit with that, how to expose yourself to that, how to not try and keep yourself safe through compulsive behaviors. Mm-hmm. So again, I think that treatment where people are now getting treatment in their house, basically, the therapist is seeing what's going on around them. So I think one is that we're going to see a shift in how mental health care happens following this. I think the other thing we're going to see happen is we are getting a lot of press around OCD. Mm-hmm. And again, one of the obstacles to people getting treatment is that they really don't know that what they're experiencing is OCD. So this is a great opportunity for people to learn about what it is and learn about what the treatment is. And again, if you go to our website, iocdf.org, we have all that information. But my third point is, I think this is going to tip some people who were subclinical. Mm-hmm. I think some people might feel somewhat traumatized by this, and this might activate cases of OCD we may not have seen otherwise.
That's very interesting. So that brings me to sort of, I guess, my next question, and maybe it's sort of a personal one for me, if you don't mind. But I mean, what would I look for to know that I might have untreated obsessive compulsive disorder? I mean, I think all of us, including myself, we have certain obsessions. We have certain things that we get overly concerned about in our lives. Having to go back inside the house and make sure that all the knobs are turned off on the stove. Whatever it is, what are the signs that any of us should be looking for to know that we might have obsessive compulsive disorder that's untreated?
Yeah, so great question. So let's start with how we use obsessions differently in psychology and in psychological disorder versus lay language. Mm-hmm. I'm obsessed with the Red Sox. When we use obsession in day-to-day language, we talk about how much we like something. Mm-hmm. Obsessions, as I defined earlier, in OCD are unwanted thoughts. These are not things I want to think about. These are not feelings I want to have. These are not images I want to have. I don't feel like I have control over them. They're time-consuming, they're frequent, they're coming all the time. I have lots of anxiety associated with them. That anxiety really pushes me, compels me to engage in compulsive, repetitive behavior. When I say I'm compulsively neat, I enjoy doing that. I'm compulsively organized, I like my sock drawer. That's not compulsions in OCD. Compulsions in OCD are driven by chronic, intense, frequent anxiety. That the intention of the behavior is, I want to get rid of this anxiety, I want to get rid of these thoughts and images. So again, we always talk about the D is important in OCD. It means disorder. You're impaired in your ability to function. It's getting in the way. So you can go back and check your car. You know, how many times do I walk away from my car and I hit the button and I hear it beep, and I'll still do it maybe two more times.
Sure.
But I'm not missing the train and I'm not missing work, right? I might go back in the house, but I'm not, you know, again, not skipping out on a social activity. So again, OCD is there when you aren't living your life the way you want to live it. It's very time consuming, very intrusive, and you stop doing things you would otherwise be doing in your life. Does that answer it?
That absolutely does answer the question. Yeah, and I think that will answer it for a lot of people who may sort of have those, you know, be thinking those thoughts now during this pandemic, you know, more so than before, where, you know, a lot of those behaviors manifest themselves a little bit more. So what is the most important message that you want to get out to the people who are living with OCD right now, whatever subset it is, but what's the most important message that you would like to get across to people living with this disorder right now during this pandemic, you know, in terms of staying safe and keeping themselves safe and well?
Yeah, so we have a great resource page on our website. We started building it about 3 weeks ago. There's tons of resources on there.
Mm-hmm.
A lot of them are really, again, just kind of a summary of some of the tips I've talked about. Super important to limit how much information you're taking in. Really pick one or two kind of sources of information that you trust that that allow you to get some assurance about what you're doing. And stick to those guidelines. If you have OCD, look at the people around you. Again, their behavior might be escalating, but try and keep it a little bit in the range of what you're seeing people do around you. I think it's extremely important to keep structure in your life. And if, you know, because this has thrown all of us out of our structure, to build that structure in. I think it's very important to stay out of your head and stay connected. I have about a dozen people in my life that I'm calling I have 3 or 4 of them I call on Monday, 3 or 4 of them I'm calling on Tuesday, and I just kind of go through that cycle and just stay super connected. Get very creative about how to use things like Zoom and these other video platforms, so it isn't just kind of talking to someone on the phone. Make sure that you're getting some face-to-face.
Mm-hmm.
Lots of people are doing viewing parties where, you know, I know families are getting together on Zoom and again, these other platforms, and just kind of checking in with each other, but making sure that you're staying connected to each other. And then finally, if you aren't in treatment, go to our resource directory on our website, and therapists are still accepting patients. You know, a lot of the teletherapy rules that were in place before have been relaxed.
Right.
So for example, we couldn't practice across state lines before. So if someone in California wanted to work with someone in Massachusetts, they couldn't do that before, and they can do that now. So everyone's on teletherapy. This is a time to get into treatment. You can still do a modified treatment that's still going to be very effective during this time.
And do you worry at all that, I mean, I know people are doing, you know, they're doing treatment obviously virtually these days, but do you have any concerns about this pandemic as it extends for a longer period of time, you know, some of the progress being undone with people's treatment, or you feel like people are going to be able to continue with their treatment plans well enough in a virtual sense?
I think it's going to be both. We are hearing people are relapsing. They're taking steps backwards. They're really feeling challenged by this. And then we're hearing people saying, this is the next new challenge. This is a great way to kind of embrace the treatment I'm engaged in. And so I'm hearing a mixed bag from folks. Some people are feeling overwhelmed by it. The good news is all of these treatment strategies are, whenever you put them in place, they work. So even if you're backpedaling and you're losing some steam as we start to return back to normal, if you stay engaged in the treatment strategies, that what the ground that you lost can be made up for sure.
This is really just, I guess, the latest of many sort of challenges that someone living with OCD is facing in their life, right? I mean, that's really what this is. It's the latest challenge.
Yep, exactly.
All right. Well, Jeff, I really appreciate your time. If there's anything else you want to get in there, I think you got a pretty good message out there to everybody about looking for help. But is there anything else you want to let people know about living with OCD during this really uncertain time right now?
I think we covered it. Like I said, lots of resources on our website. My job has kind of doubled because we're continuing to plan events that may still happen. We're, rescheduling events, in-person events that we can't have right now. And then we're developing all these online resources. So lots of virtual resources for people to take advantage of. And I'd really encourage people to look those up.
Yeah, the help is out there. It's coming in different ways, new and virtual ways, but the help is still out there, and that's certainly a good thing. All right, well, it's been a pleasure talking to you. Thank you so much for the insight on this topic. Hopefully, folks learned a lot here. I certainly did.
You as well.
Yeah, I really
Thank
appreciate
you for giving me the opportunity.
Jeff Shemansky, beg your pardon, Executive Director of the International OCD Foundation. Thanks so much for taking the time. You stay safe, be well, and we'll talk to you soon.